Hi, I'm Leonie, a women's health physio and pregnancy Pilates instructor. This series is designed to help you move safely during pregnancy, build strength, support your pelvic floor, and more importantly, some much needed release. Before we start, please always listen to your body and consult your healthcare provider if you are unsure. Let's get moving. Before starting this series, it's important to understand our pelvic floor muscles and their connection to our breathing muscle, the diaphragm. So our pelvic floor muscles are a group of 12 muscles that sit at the base of our pelvis, and they are there to support our pelvic organs, our bladder, our uterus, and our bowels. Our deep core muscles wrap around our abdominal cavity or abdominal wall, and our diaphragm is the big breathing muscle that sits at the base of our rib cage. When we have good coordination of our breathing, we breathe in through our nose, down into our lungs, and our diaphragm lowers down to bring more air into the rib cage. Because we have tummy contents, it's got to push those tummy contents out of the way, and it asks that deep abdominal muscle to relax and expand, and ask that pelvic floor muscle group to relax and lower to allow more room. We breathe back out, the diaphragm pushes back up to push the air out, and it simultaneously asks that deep core muscle and pelvic floor unit to lift up and contract to help push that air back out. So as we are breathing in and breathing out, that diaphragm, pelvic floor, deep core unit just works in unison together. So in Pilates, we work on the coordination of that muscle unit. I'm going to go through some breathing exercises with you now to help you find that coordination. So the first position we can start in is sitting upright, and we can place our hands down at the base of the rib cage, so either down facing this way or tucking them under. As belly is expanding through pregnancy, there's going to be a lot of tension and pulling through the front of the abdominals. So this position is a great way to try and get some air into the lateral edges of that rib cage as well, so that we're expanding all the way through that kind of 360 degree and not just expanding out through the abdominals at the front. So in sitting, we're taking a big breath in through our nose, down into the base of that rib cage, and feeling those hands expand out the side. So it's a big breath in, and then breathing back out. I like to envision that I'm breathing out through a straw. So big breath into the rib cage, down into the belly, and breathing out. Just try 5 nice deep breaths here. Good. So the next position that we can get into, which is a great way to get some movement down into that diaphragm, is in the hands and knees position. So coming around into 4-point, hands are just underneath the shoulders, knees are just underneath the hips, and you just want to make sure that you've got a nice long spine. So we don't want to be dropping down through our lower back. We just want to bring that spine nice and long from the back of our head down to our tailbone. But from here, you're going to let those tummy muscles relax. So take a nice big breath in through the nose, down into the base of the rib cage. Feel that tummy going nice and fat. And then we breathe back out like we're breathing through a straw. And you'll gently feel those lower tummy muscles contracting, almost like you're just bringing baby back towards the spine. And then we take another deep breath in. Let those tummy muscles relax. Fill that belly up. And breathing back out. Feeling those tummy muscles coming a little bit back towards the spine. Let's do 3 more here. Big breath in. And breathing out. Big breath in. And out. Big breath in. And out. And then the third position that is a really nice way to not only breathe deep down into that diaphragm, getting a nice big belly breath, but it also is a really nice way to get right down into that pelvic floor to help relax the pelvic floor. A lot of first-time mothers don't actually have a weak pelvic floor. They have a tendency to have more of an overactive pelvic floor. So it's really nice during pregnancy to be able to be breathing down through that diaphragm, letting that pelvic floor relax, and then breathing back out. So the next position is from the 4-point position. We can take those knees a little bit wider and just sending our bottom back towards the heels, allowing those arms just to rest out in front of you and just sink down into that stretch, resting your forehead. And from here, you're going to take a nice big breath down into the belly, down into the pelvic floor, and then we're breathing back out. 5 breaths here. Last one. Excellent. Now you've all got some coordination into that diaphragm and starting to really understand and picture the breathing techniques needed for Pilates. I'll see you all over in the next video. Well done. I hope you're all feeling much more relaxed. If you enjoyed today's class, then please make sure you check out my other videos in this Pregnancy Pilates series. And you can also find more resources over on my website linked below. And please feel free to come and say hi on Facebook or Instagram. Thank you for moving with me today. I will see you all in the next video.